to please come by to the stage and join us. We should have about 15 minutes of questions. Oh, we're doing that? Sorry, there is a microphone going around. No, come to the microphone. Thank you.
Hello, yeah, my name is Ili Rees. I have a question for Dr. Perez. How does a patient reach the state where he or she taps into a past life? And what methods does the therapist use to lead the patient to recover this memory?
Well, this answer would be so long, but we use a relaxation based on diaphragmatic breath, so the patient gets the inner state more relaxed, more calm. As you saw, the prevalent waves or alpha waves in occipital area. So this seems to be the gate to reach unconscious content. You must be quiet in inner state of relaxation. So this is, in few words, the way we can establish the connection with unconscious mind. After that, we can count from 4 to 1, and once we say 1, we ask to the patient just say whatever comes to their mind, like sensations or feelings or emotions, figures or landscape, whatever. And the regression starts actually at this point. So I would invite you to read some papers about this theme. And unfortunately, I couldn't be explained detail by detail, but it's a very important question. So if you could download this article in my website, you will see exactly the structure of this approach that we apply in Brazil. Thank you.
Thank you very much. Do we have another question from the audience? To the microphone, please.
Hi, Dr. Julio. I have a son. He's 20-year-old and he's bipolar. So he tried to commit suicide like 2 years ago, and I'm thinking about like regression, because sometimes I read some things that regression could help them to solve problems from mental diseases that they have right now. Many people have, like by following what he had, I saw many kids that had problems.
Mm-hmm.
So I'd like to know your opinion about seeking for regression.
Yes, memory regression. Sorry, did you finish? No.
I did.
I think memory regression therapy is quite indicated to this case. However, I'm not able to indicate psychotherapists here because I don't know, unfortunately, good psychotherapists. It's important to realize that the memory content brings a psychological dynamics, an history, and if this history is replicated in the current life, the patient must be aware of that, because sometimes the traumatic event is pretty much related to victimization, and the patient had other events in present life exactly aligned with the victimization. So it could be as well a script that he or her is
Yes.
replicating from the past. So beware about a good indication of therapists. You cannot solve a problem in 2 sessions. As I showed, this is a therapeutic process that takes around 6 months.
I know. He speaks Portuguese, so maybe I'll talk to you later in private. So thank you very much.
Welcome.
We have time for one more question.
This is a question for Dr. Liven. Okay, it's working.
Yeah.
Dr. Liven, in your talk, you mentioned that in one of those slides that there have been efforts to explore kind of a life force or different ways of describing that before, either using technology or experiments. Do you remember that slide? I'm not sure if I'm describing it correctly.
I'm not sure. Was this early on?
It was on basically efforts to explore or to study basically subtle energies, which you described was not the subject of your talk, but that you think that you have encountered some of those efforts. And I was wondering if you could share some
Maybe
of those.
it was, well, I made a reference to Dan Benor, and Dan published, beginning 1980s, it's gone through several editions, a book, I guess the current name is Spiritual Healing. It's a wonderful book that summarizes results of, at the last edition I saw, about 200 or maybe 199 either RCTs, randomized controlled trials, or other types of clinical studies of spiritual healing, energy healing, prayer for people, for animals, for other biological systems. That's probably the best place I know of to kind of encounter this literature. Larry Dawsey was in 1993 or 4 when he had his best-selling book, Healing Words. There was an appendix in the back of the book that actually summarized some of Dan's systematic review or meta-analysis at the time, but there's been a lot more work since then, so I'd refer you to Dan. The interesting thing that he did in his book, not only does he summarize an annotated bibliography summary of all of these studies, there also is a large section in which he outlines a variety of the different types of theories or conceptual models that people have come up with to make sense of all of this. So he delves into the how and even the why question as much as critiquing the studies. And then yet another thing that he does in his work, he came up with a 5-point methodological scale to rate the methodological goodness of these studies, for a better way to put it. Because one of the skeptical critiques of, this is just all nonsense, the studies are all crap, they're terrible, or they're published in parapsychology journals and you can't trust any of that. Well, none of that's true. He identified, I think of these 200-some studies, about 3/4 of them, indeed, there were some methodological challenges, but about 1/4 of the studies, so the last I saw, about 50 of these, really checked all the boxes. These were very, very good empirical studies of some type of energy healing or spiritual healing or subtle energy healing. And the fascinating thing, it was the well-designed studies that one was more likely to find a positive therapeutic effect or an efficacious effect. I think of the studies that were poorly designed, only about 1/3 had a statistically significant effect. Of the studies that were really well designed and seemed to be the best designed and the analyses were done competently, as high as 2/3 found something. So again, I would defer anybody to Daniel Benor, Benor, his published books on spiritual healing. That's the best place I know of to find really detailed accounts of the empirical literature on this topic, not just in people, but in pets. There have been studies of prayers over plots of mung bean sprouts, and the ones that loving, energetic intent was sent to a certain plot of sprouts. They grew better than the ones that didn't have that intent. So it's a fascinating literature. Wayne Jonas is another person who's written about this. Larry Dawsey, I refer you, of course, any Gary Schwartz's works. If you want a more theoretical, really more almost the biochemical, biophysical take on this, read anything by Jim Oshman, Oshman. He's written a couple books, almost like medical textbooks.
Thank you very much. This is all the time we have. We thank you all for being here with us on the stage. We're going to take a break right now. This is a time where you take to get your books signed and mingle among yourselves, and we'll be back at 4 p.m. sharp. Thank you so much.